Hello everyone. I'm hoping by the time I'm finished, maybe there are other people, well actually for your sake, no one can share a COVID experience, but it would be interesting if there is anyone else, if they want to join in and share. So I was diagnosed in late March. That was a time when basically COVID was only just beginning to take off, so it means that everything was a little bit more unknown about what was happening. One of the community transfer cases where the actual origin of where I got it was supposedly unknown, but I had looked after people's house who'd been to the US and they'd been on a cruise, and at that stage people from the US actually weren't eligible for testing and they were told they were fine. So I think a reassuring thing now, if anyone is actually to contract COVID, is that there's a lot more screening going on and we're a lot wiser at this point. There's greater wisdom. Leading up to it, the sort of symptoms I experienced is I had really achy muscles, a lot of fatigue, breathlessness. I noticed I had a lack of smell and decreased taste. All those things I kept actually questioning, should I go and get tested? Shouldn't I go and get tested? And I'm just going to say to all of you, the takeaway message with this one is, no matter what the symptoms are, just go and get tested. The criteria have now loosened up and it just saves a lot of effort later on. I also noticed when I exerted myself, I'd be nauseous. That still didn't, it was only when I got a temperature of over 38 that I thought, okay, I need to be tested. And as Addisonians, I think it's really important there's always a thermometer, because whenever you do have a temperature, we all know that's when we need to up our dose. So that is when I went and got tested. But then 2 days later, even after tripling my dose, I was exhausted and all I wanted to do was actually just lie down and sleep all the time. And so at that stage, the endocrinologist hospital, and the important next message there is, if you actually triple dose the cortisone, it can actually mask some of the symptoms. So if you've got a chest infection or you're starting to develop respiratory issues, it can mask it. So they just put me in there as a precautionary basis to have a chest x-ray, which came up clear. I was really lucky. But then again, because it's COVID, it's from day 5 usually of contracting it to day 10 that are considered to be the worst symptoms. So as a precautionary measure, because our health system is so well set up for this, they kept me in there, so I felt super well cared for. I stayed in hospital for 3 days. The thing is, I was a mild dose of COVID, definitely, and I think the important thing here, I wanted to safely manage the Addisons, and every single day I was reviewed by an endocrinologist. Every single day I was reviewed by a respiratory specialist. Everybody communicated well. They communicated really well as well with my external endocrinologist. After I came out of hospital, I was isolated into 2 rooms for between about 3 and 5 weeks, because it took me 7 weeks to actually, no, more than 7 weeks to actually be clear. I was diagnosed on the 20-something of March and wasn't clear till the 6th of May. After that, I isolated for between 3 and 5 weeks. Again, I think the recommendation for people with Addison's disease is it's actually quite hard to keep that exercise up, but it's incredibly important if you do end up in isolation, even if it's not from actually having COVID, but just in this period a lot, because we're actually prone to other issues. Every day when I was at home, the nurse from the COVID clinic would ring every single day. And if there were any issues, straight away, I'd have a specialist on the phone to me. I would have a respiratory specialist. Our health system is fantastically set up for this. The slightest issue, they'd say they wanted me to return to COVID emergency, which was set up. You felt completely safe there. And what I will say is, you felt like the follow-up and the care was absolutely fantastic. And across the 6 to 7 weeks, I was very aware of how much they were actually setting up our health system to actually cater for things if cases increased. And I feel at this point, we've got to actually be really reassured that there's a huge capacity that's actually available. It took me 7 weeks, as I said, to be completely cleared. And as a health professional, I had to have 2 swabs to be cleared, but that doesn't necessarily mean for the general, if that's the case. One reason they think it may have been is because you're carrying dead viral material for a while afterwards, which is normal with the flu. So if I was thinking the main messages from mine, I felt extremely well cared for, and I felt the communication in the health system was brilliant, and I found it really reassuring. I think the shutdown has really allowed the health system to gear up. So if anyone was actually to get COVID now, I just sort of think you have to feel fairly confident that we're actually in a very good system. I think the other thing is Addison's disease doesn't necessarily increase our risk of getting COVID, but it certainly makes the management, and it's important to remember all the dosing and use and everything. The other thing I've noticed, and I don't know what other people think, but whenever I've gone into an Addisonian crisis or anything's happened that I find cognitively or my head's not very clear, so it's really important to have that medication list, to actually have your Addisonian letter with you, and just really important to have enough medication on hand. Because when I came out of hospital, one of the things I had to do was quarantine, and I had stockpiled massive amounts, and I was actually really pleased I had, because it would have been quite difficult to get out and get the medication, and I had to triple dose for quite a long time, and it took me a long time to wean. I will just say that I am a fit person, and so the thing is, I had a high level of cardiovascular fitness. All of us are different in what we have. So, you know, and I was a mild case. So it doesn't mean it's going to be the same for everybody, but I have to say I find it very reassuring how our health system actually handled everything.
Laura, sorry, Laura, there's a question. Which hospital and health district did you go to?
Okay, so I was in Southeastern Area Health Service. So that's for the Sydney area and Southern Sydney area. And I was in one of the smaller hospitals in that area, which is Sutherland Hospital. It's not small. And even in a smaller system, it was brilliantly set up. I could not fault the care the whole way along. And the only reason I probably did actually end up with COVID was because I have a different immune system issue. And I will just say that in the week leading up, I sat in the car with my 81-year-old mother, and she didn't contract it. I was with my husband, I was with my children. None of them actually ended up with COVID. So I just think it was because I am compromised in other ways with immune system conditions, but it's not Addison's disease. Addison's is just where you have to concentrate more on the management. So I'd be interested to hear if anyone else has had that experience or questions. I'll open it up back to you, Linda, if that's okay for this point.
Sure, okay. So, and just so that everyone knows, I have Bronwyn on my mobile phone, which is sitting next to my computer, so she can hear everything. Do you want to say hello to Bronwyn? Say hello, Bronwyn. Bronwyn, do you
hello, everyone. I have a beautiful speech to welcome Laura, but I'll send it to her later. And thank you, everyone, for coming. And thanks, Linda and Diane. Thank you. Keep going, Laura.
Thanks, Bronwyn.
Okay, so we've got some questions, Laura. Well, there's a thank you from Vanessa. Di's asked, how long did you stay on triple dose for?
This was actually, so from the time I actually got COVID, I was diagnosed on the Friday, and they got me to start triple dosing immediately. Then all the way through because the worst days of COVID are known to be day 5 to day 10, they made very well. When I was in hospital, I was put on IV hydrocortisone straight away, just in case I went into an Addisonian crisis. So that was actually 4 times the dose at that stage for this. So that would have been from about day 2 to about a day 5. At day 5, I stayed on triple dose. And then I was probably triple dosed all the way through for about 4 weeks after that, simply because every time I tried to start weaning the dose, I was absolutely fatigued. And so it would have been about 4 weeks, but they were very, very careful about me weaning 5 milligrams per day. I'm on Cortate, which is going to vary how you wean depending on what medication you're on. And obviously a medical health professional will have to advise you on that. But it certainly was about a month or more, and it was about 6 weeks before I returned to my normal dose. And even now, after I've had COVID, some of the complications haven't completely disappeared. The biggest one's probably fatigue. I've still definitely got the fatigue, which has now been going on probably for, it's close to 3 months since having it. And one of the complications is a chilblain-like thing in your feet, which I've got. But they're gradually going, oh, this is associated with COVID, that's associated with COVID. But I think the important message is, I actually feel like even if all those things have happened and the complications are there that I've managed, I've come to the other side of it and I feel okay.
Did anyone want to have any other discussion around the COVID stuff at this point?
We returned from overseas just before the hotel quarantine.
Mm-hmm.
And we self-isolated, but a lot of friends who were dropping food parcels and things at the door, and that told us that they'd heard that older people weren't going to be treated. So has anybody, I don't know, had any experience with that? They just said that would, you know, the hospitals would treat younger people, but not people my age, 66. Yeah, so I don't know what the situation is. Kept away from everybody.
I'm actually an ex-emergency department nurse,
Yep.
and I still have a lot of friends who work within the emergency departments. And when there was the initial shock that they thought that 130,000 Australians were going to die, because when they did their, initial predictions, it was going to be that half our population were going to get COVID, and we were going to lose hundreds of thousands of Australians, not just Addison people. So at that point in time, we didn't have enough ICU beds, and we didn't have enough resources to actually treat that many people. So there were discussions around triaging people for those, resources that were available. At that point in time, it wasn't that they were going to do, like, it happened in Italy and other systems as well, where they had to say this person has more of a chance of surviving those sorts of interventions. They're the priority, those interventions, whereas this person, they have this comorbidity, their age, to put them on those resources was going to be where they'd have to make these really difficult choices. Fortunately, because of Australia shutting down and, doing all the stuff that we didn't have to get into that situation where those decisions were made. But there was, in the initial worst case scenario predictions, there were discussions around that, but that definitely wasn't anything that was being executed or communicated to health systems to be actually activated upon. So if any one of us presents to the emergency department now, we would receive exactly the same level of care as any other person. And I put I'm not over 60, but I have more than 4 autoimmune diseases and perform very poorly in most health situations. And so if they were looking at me, they would not, in that worst case scenario, I would probably not be a viable candidate to receive interventions over somebody else. But we are not in that situation in Australia. I'm just so thankful that everybody did what they had to do initially so that our health wasn't facing that.
I think, we sort of missed a lot of that, the early discussion, because we weren't in the country, and 2 of our kids were telling us, maybe you should rethink your travel plans. But when the 3rd one actually told us that, we thought, oh, it must be serious, and we changed our flights.
Yeah.
All right. Well, listen, Laura is back on. Laura,
can you hear me?
We can now. Yes.
Perfect. And you probably can't see me. I'm just trying to get a camera up and running on a different system.
Listen, we've got another question, Laura, that you might be able to help with. Is there a difference to being treated for a bad flu versus COVID?
I've actually had a bad flu before, and I have to say I found a bad flu probably worse than COVID. But again, I'm actually going to say I had a mild case of COVID. The actual treatment regime was the same, where basically you're told to triple dose, keep an eye on your temperature, and you're really careful with the weaning process. But I'd say the bad flu was actually worse. So I want to talk, I work as a psychologist, and one of the things is I've noticed is that across the time, from the time COVID started all the way through to now, there's been big changes in what the challenges really have been. So to start off with, it was very much, I think we all felt like we were in the same boat. We were trying to deal with something we'd never really dealt before. But I think very soon there's a change in how those sayings work, and it very much fits what's going on, is that we may be all in the same sea, but we're actually in different boats. And when I give you that advice, I just want you to think we all have different conditions. We all have different circumstances in life that we're actually going through, and different challenges. And that very much means that there's an individual experience, even if we are trying to deal with stuff. But then as we move into this next phase, I think what we're finding is that if you look at Victoria, the fact that the actual sort of rates of the incidence has increased so much, whereas I'm in New South Wales and we're not actually having those increases. It's now we're in a different sea and in a different boat. So when I talk about the different struggles people are going through, obviously your individual situations are really going to vary on how that impacts on things. Obviously the same rules, I'm going to say, as we, in different states, as we try and move out and try and stop the sort of heavy level of isolation that we've been through, we're going to continue on. One of the most important things is we continue on with all the health rules. Obviously being the physical distancing, I think we've heard all of those ad nauseum, but I'm going to say them again because I just want to say that no matter what other advice I actually give or suggestions or discussions, they have to stay in place. We keep the physical distancing. Even in your family get-togethers, there's been obviously that thing where you actually feel, there's a natural feeling us, the people around us must feel safe, must be okay, and that's not necessarily the case. So it's to make sure we keep that physical distance. If you're in a hot spot, obviously you're going to be more careful about where you go, who you're actually with or going out. Try not to go out at peak times. But I think one of the biggest things is everyone thinks it's actually the anxiety around COVID that's the biggest issue. And as a psychologist, I haven't necessarily found that to be the case. One of the main issues I've found is actually the social isolation that people have experienced. And rather than anxiety, it's actually depression that's been the problem. That depending on your situation, this varies substantially. Some families have got to isolate where they've isolated with a big family and you've got the issues rather of everyone getting on each other's nerves, but then other people might be very much on their own. They're older, they're not necessarily seeing family, they're in a higher risk group, or they've got chronic health issues as we've all got. And there's a couple of tips I'd like to actually suggest that other people have found helpful and open it up to the floor for what other suggestions people might have. But we're actually social animals as human beings, and we very, very much need social contact. Obviously, we all differ in how introverted or extroverted we might be. Some of us need people more or less than others. But it's incredibly important that we actually actively try and keep some of that social contact. And one of the safest things is to go for a walk and to go walking in areas that are really quiet. I was talking to someone in the beginning of this where they were saying that people aren't doing the social distancing when they're walking. Go to places that are quiet, where people are staying away from each other. You're not touching surfaces, but you can smile at people, you can say hi, you get that feedback back. It's something that's really important. Don't go, when you're walking, don't pat everyone else's pet, which has been my tendencies, because that's a fantastic way of spreading COVID. So you sort of feel safe because it's an animal. The other person was patting it too. Make sure you make video calls with family. And, you know, we're all of a different generation. Yeah, I know for younger people, they hop on and off these things really easily. But as you get older, some of the things that are actually available are not things you've grown up with. But it's quite important. And I've loved the tutorial from Linda today in terms of how to use Zoom and how to have contact with people. Really important if you can, if you've got neighbours nearby, even if you actually stay in your own gardens. But they're all different ideas for how you can have that social contact without increasing the risk. But it's really important to make a special effort. A really challenging group at this stage is for young people, for teenagers, if you have got Addison's disease, or you are having to isolate more, because social contact in those years is incredibly important. It's easy to feel left out. It's easy to become isolated. It's easy to feel that no one else is actually trying to contact you and you've been left out. But you've got to remember, are you actually also making that effort to reach out? The other thing that's not really good for depression or feeling good about yourself is Groundhog Day. I think with isolation, there's a real risk that we just do the same thing over and over every day. And I know for myself, obviously I've been stuck in the house for a really long time. So I couldn't cook for ages and ages, for about 5 or 6 weeks, which is not a bad thing. But by the same token, one of the things I've done while I've stayed home is tried to cook an international meal from, you know, a different country every night, just as an entertainment, or started hobbies. And it's really important at this time to start hobbies so it doesn't become Groundhog Day. Otherwise, you really risk getting depressed. There's also obviously for other ideas, gaming apps, etc. And I'm sure when we open the conversation up, people can talk about what they've done to actually stop feeling like you're having Groundhog Day, to feel like you're actually being entertained in your home, because it's really important you maintain a routine and actually have some sort of interest and meaning in your lives. So that's probably the biggest thing I've found, is that depression from isolation. The other things, like anxiety is a big thing. Before I move on to anxiety, has anyone got any questions about that really, or discussion points or comments about that incredible socialization, or, you know, social isolation, or just feeling like you are living Groundhog Day, or suggestions for other people?
John?
I can say I've just been for a walk this morning and I've patted several dogs. I didn't realise that patting dogs was not good.
Thanks,
I
John.
have to say, John, after about 4 weeks of being forced to quarantine by public health, they allowed me to go for a walk, and I took my dog with me, and it was amazing. I did my best to stay away from people, and everyone kept walking up to pat my dog, and I just kept thinking, oh no, I didn't want to tell people, don't pat anyone's dogs.
So does anybody know how long COVID lasts alive on a dog?
Oh, it would be similar to what it would be on surfaces, which is anywhere from 7 hours up to about 3 days. But because it's an organic surface, it will wear off a lot quicker. It's the shiny, smooth surfaces like glass and some metal surfaces that will last for days at a time. But there has been some research come out of South Korea that has shown that COVID has lasted for longer than 14 days on certain surfaces.
Wow.
That's actually some research stuff that South Korea did after they swabbed the cruise ship that was affected.
I've got another question about COVID that I've asked several COVID organisations, but I've never had an answer. If someone's had it and then cured from it, like they're over it, do they still have that gene in their body, and can they then reinfect and re-fall for the disease?
John, they actually don't know that at the moment. One of the things they've done is the people who've had COVID are being enrolled in a long research study with it, because they don't know whether you develop antibodies to it yet. This is, as a patient, I can only tell you. Maybe Vanessa, from a medical perspective, you could add more. But I know that I've been told they don't know if you do develop antibodies. They don't know how long you will remain immune for. They don't know if you have any form of protection at all.
There's a chance that actually everybody that's ever had it has still got it.
What they've actually said, as I said, it took me 7 weeks to be clear. Their assumption at the time is, just like influenza, is for a long time you're shedding dead viral material, so you will actually test positive, but you're not infectious anymore. No one can get it from you, but they don't actually know that. And I think that's been one of the challenges the whole way along, is that they're learning as we go. Even when I had pains in my feet, when I first went, they thought I had gout, but it looked very unusual. And then they turned out that all of a sudden the people with COVID were having pains in their feet. So I was sort of progressing as new things were being found. But by the same token, they don't know yet whether you develop any immunity to it. And even the people in China where they said they were getting reinfected, it could have been dead viral material. So Vanessa, have you got more to add to that?
Oh, I disagree with everything that you've said, because
good, go for it, because you're from medical. Yep.
Yeah, because no, I agree with everything that you've said.
Sorry. I was thinking, oh no.
I agree with everything that you've just said. They really don't know. There's so much that they don't know and understand about COVID. So I think that we just all have to be, use our common sense, look at your own situation, your own medical conditions as well as Addison's, and make the best decision and choices. Zeke, just come here a minute. One of the things that I found that is, if you do actually wear masks, like this is my son here. So he's about to go out with some friends to Brisbane. And so he's wearing a mask that I've made. And what we find is that pretty much everybody avoids us.
It's good.
So they don't touch your dog. They step a wide berth away from you.
Besides some people.
Because so I actually find, so while that masks aren't a be all and an end all, and particularly if you touch the front of your mask, you've just reinfected yourself, so I'm not saying wear a mask in terms of stopping yourself from getting COVID, but it is a visual reminder to yourself, to your family members, to people around you, to avoid you, so I just find that that's a useful tool. And I saw someone made a message about washing your hands. That is our single most effective technique we can use. And when I do go out, like for about 4 months, I didn't actually leave the house at all. My GP made me stay isolated, and my youngest son stayed isolated with me. So we homeschooled. Because Queensland's got no cases, and to be honest, I actually find having the border shut quite an assurance for me. So my son's gone back to school, but if we start to have spot cases again, then my son will have to come out of school and we will self-isolate again and not go out of the house. But at the moment, I mean, I went out to Aldi for the first time just this last week. My son and I, we wore masks. And yes, other people weren't socially distancing, but when they saw us with the mask, they tended to kind of give us a bit more of a wide berth. So I think use whatever strategy and technique works for you to provide you with the assurance that you've got that you can still function effectively. Is that what you would recommend too, Laura?
That is, and I think that comes to sort of the thing of anxiety as well, of starting to go out and starting to put all those things in place. I think for all of us at this point, there's a lot of anxiety, and it's normal to have a level of anxiety about starting to go to Aldi, starting to go to shops. I like the idea of bringing the face mask because it does remind people. And then also, if you do actually end up with COVID, you actually protect people. You may not know you have it. But I think the important thing is you'll feel anxious. That's a good thing because it's going to keep it at the forefront of your mind. You wash your hands and you do all the correct things and you social distance. But we've also got to be really careful that anxiety doesn't actually completely take over and people end up staying home or totally and utterly isolated. So you have to actually check yourself and actually say, are you keeping up with the kilter of society? Are you starting to notice you're far more isolated? Naturally, as a group of people with Addison's disease, we will isolate more, but you don't want to stay there because you're absolutely terrified. So you have to actually start saying, you know, you've got to start challenging things and realizing in Australia our numbers are actually fairly low, especially in Queensland. It is, you know what I mean? I understand why you want the borders to stay closed. It is, you can actually go out, whereas maybe in Victoria at the moment you're saying, okay, if I live in a lower risk area, I'm going to be careful about where I go naturally, but I can. But if you're living in a high risk area, you are going to continue to say, it's reasonable that I don't go out in that area because it's higher risk. So it's just making sure you're not over exaggerating what the risk is around you and becoming anxious and starting to believe things that are not true. Because in Australia, we do have a low rate. It's been very, very well managed. And I'm just saying, don't overestimate the bad consequences and be completely focused on it, because it can end up doing your head in and actually sort of changing how we live lives. It's really important we actually sort of stay calm and sort of try and recognise that we're all still alive. We've all still got air compared to other countries. You know, we're just in so much better place just to try and actually quell some of that anxiety that comes with going out. But Vanessa, I really like your idea of reminding other people with a face mask and having hand sanitizers and stuff. I've got quite a bit more to say about anxiety in terms of what you can do to decrease it, but are there other thoughts or questions at the moment, just so that I don't just end up giving you a dialogue, you know, rather than you having an interactive session?
There's some other ideas in the chat, people talking about going hiking, suggestions of taking your Cortef, and different advice that people have received from their health professionals. I mean, I've been advised to stay indoors by my endocrinologist too, but you know, life goes on, so it's just about being careful, really. And I think at this point it's about just living with it, isn't it? Because it's not going to go away and we can't stay shut down forever. And so it's about finding a new way of dipping in and out of society in a way that you feel comfortable with, I think.
There was a question there about gloves, wearing gloves when you go out. I know there's been a bit of discussion about that. I know my daughter seems to think it's not necessary, but I wondered about, you know, maybe Vanessa could give us a hint on that.
I responded to that in the chat and I said, no gloves, you don't really need to. What I do is this is like just a nappy wipes for babies. And what I did was I put inside it the surface ones, you know, not the ones for your hands or the baby ones, but these are like the actual Dettol ones for surfaces. So I have that in this nice little bag. So that goes with me in my handbag. my kids and I have multiple of these absolutely everywhere with us. So they're in the car, they're in the handbag, they're in our pockets. And so if I do have to use a trolley, I use one of these to wipe down the trolley first. Then I hand sanitize afterwards. If I touch my mask, I hand sanitize afterwards. So every time I touch something that someone else could have touched, or if there's been droplets that I've breathed onto the mask, if my hands touch that, then it's now on my hands. So I just always think about, you know, and if I was wearing gloves, they would be on the gloves too. But then the gloves give you a little bit of a false sense of security. And if you don't know how to use gloves effectively, like if you're trained in the health sector, you will actually infect those gloves, and then you will infect your gloves with those. You will infect gloves yourself with the gloves. So you're better off to use things like wipes that you can dispose of. And then after you've cleaned something down, always hand sanitize, because in that process of cleaning it, you may have infected yourself. So then use the hand sanitizer. You know, if you open a door or something to get into a facility, or, you know, whatever, hand sanitize afterwards. Just constantly hand sanitize. When you come home, wash your hands with soap and water. I usually wash my hands twice with soap and water. So I'll do the first 20-second wash, and then I'll do a second 20-second wash, and I make sure I go up my wrists as well. But I'm an ex-nurse, so I'm a massive hand washer. I probably wash my hands about 15 times just when I'm doing a dinner. So it might not be something that you guys naturally do, but the more that you do it, the less chance you have of getting yourself infected. And teaching your family members. So I've had to teach my kids, if my kids are going out and they're coming back into the house, and they've lately started bringing some friends over. So everybody hand sanitizes before they come into the house, and I socially distance from all the people who are not part of my family. That's the best I can do, but we have a very low case of it in Queensland. So I feel confident doing that I'm getting my life and my kids' life back to a little bit of a normal, but we're utilising what we can.
And Vanessa, I'm going to jump in on that and say, I think those are all incredibly important pieces of advice that we all put in place. And then from a psychological perspective, it is making sure with putting all those things in place that you can do all the reasonable things, you've got all the coping skills that we can possibly do to keep us safe. But as human beings, it is incredibly important we don't over-isolate. It's incredibly important we are in check, that we're not completely catastrophizing, and we get rid of the sort of media stuff, and we do, to the best part, get our children back to living normal lives and not sort of communicate messages of absolute terror. Because in Australia we do have those low rates, and we do have all the facilities and our health systems in a really good place to actually cope now.
Yeah.
Thanks, Laura. Did you want to talk a little bit more about the anxiety, Laura? Did you want to say anything more about that?
I was going to say another couple of tips that are actually quite useful is actually, and I'll try and cross the different sectors, it's reducing media exposure is quite important. One of the things when I first got COVID was I saw the things on the TV, and then I saw what I was going through, and I saw what the people in the hospital were going through. They were almost totally different things. Obviously the media is going to show you the worst of the worst. That is definitely not what it looked like from the people who I was exposed to in the hospital, in separate rooms, of course. On the media, you're seeing the worst of the worst, and it does actually elevate your anxiety. And I just say to yourself, we as human beings are used to actually coping. We're in a new thing where there's uncertainty. We don't like uncertainty, and we take time to adjust to uncertainty. But after 9/11, for everyone who remembers, I'm sure everyone is old enough who I can see on the screen, people for a while were uncomfortable, you know, going into shopping centres or doing things, and we sort of adjusted, and then we got used to it. And again, with this, you've just got to recognise there's going to be some anxiety to start off with, but it's important that you just gradually extend beyond your borders, recognising there's anxiety and changing things, but it's important just to gradually make sure you're not isolating, you're not catastrophizing and saying the worst that's going to happen. And with children in particular, if you've got children, obviously as a parent, if you've got a child with Addison's disease, you are going to be anxious because they need to go back to school, all that but what's also really important to remember that the incidence in children is really low. And the other thing is if they do get COVID, that it's generally not serious at all. So when you speak to children, it's important to be really honest and really upfront about what's going on, recognising they know they've got the skills and not actually transmitting our anxiety as parents if we've got a child with Addison's disease as well. In terms of workplace anxiety, as people gradually return to work as well, you start worrying about who in the workplace is going to be sick, what happens if they come in. And I think it's important to actually preempt it with bosses and stuff and say, well, how are we going to handle this? If you are someone who runs and you are the boss, it's important to say this is the sort of etiquette of how we're going to handle things so that you know beforehand. But it's very much the case there needs to be something put in place so you're not left in those awkward situations. So that's basically on the anxiety front. It's going to take a little bit of time. Don't catastrophize. Try and get out there. Try and socialize with children. Try and communicate with them nicely and very honestly, but and not transmitting your own anxiety. I'm trying to. Do we have any questions about anxiety at this point, about other things that might help?
Laura, I think one of the things I thought was useful on your sheet was just breathing. And I know that, you know, in Geelong, we've actually got a few other things going on as well that we're handling at the moment with a lot of youth suicides and what have you. It's terrible. But my daughter and I are remembering to have to breathe. Sometimes we find ourselves actually having trouble breathing, and you know, that's sort of scary with the whole COVID thing, but I think it's more of an anxiety thing. And that advice on that sheet that said breathe, and it's actually remembering to breathe.
Okay, so thanks Linda, I'll come to that. So I think there's a thing is you can get really caught in the moment, you can become incredibly anxious just thinking about things, and it is actually just important to slow right down, to try and be in the moment, to try and actually breathe. And one thing they will say, even when you've got COVID, when you wake up, is in the morning to try and breathe and get everything in your lungs. But as an anxiety measure, it's really important to breathe. Try and think of all your senses, trying to be aware of what's around you and stay grounded in the moment. Okay, so you can think about what you can smell, what you can touch. So your head's not busy, your head's not thinking about what could happen or, you know, and getting caught up in those. It's actually trying to be in the moment, get involved in your 5 senses, just trying to stay as calm as you actually can about things and actually reassuring yourself about what can actually happen. So it is important to remind yourself, go out and actually have some fresh air if you can, again with the social distancing, because it's so important, and have some exercise just to try and stay healthy. Just reminding ourselves here that we're in a safe place to a certain extent, as long as we social distance and do with what Vanessa says, we actually can go out, smell the trees, look at the bark, but try and actually completely ground ourselves and stay calm. Linda also alluded a moment ago to this. During this time, there've actually been some terrible catastrophes and sort of crises that have happened where people have lost their lives, or people have lost loved ones, and people haven't been able to go to funerals or haven't been able to actually have time to mark the occasion, which is, it's been very difficult for people. And that's why I encourage, in terms of depression, in terms of everything, it's really important not to socially isolate. It's really important to try and reach out to people, to take every opportunity, especially for young people, and especially in the adolescent years where you can feel very isolated and you can feel very alone. If you have lost someone, it's really important, if you can, actually maybe set up situations like Zoom meetings or other sort of meetings like this where you can talk about the person and you can share moments about the person. And if you're really struggling, it's even to reaching out to some of the organisations like SANE and Beyond Blue, and I'm very happy to send a list, because there's going to be a lot of, it's going to vary very much individually what's actually happened. There's also going to be the situations where, maybe for the Victorians, where you actually feel quite traumatised by all the having to shut down and having to isolate. And all of a sudden you see all the toilet paper disappearing off the shelves, you see all those queues, so you feel a bit re-traumatised by it. And again, I'm going to go back to what Linda was saying a moment ago. It's important when you see that to go, yeah, this does feel traumatic. It feels like we're back to square one. But actually say to yourself, we're not necessarily back to square one here. And to try and, again, to breathe, try and bring yourself back to the moment and just try and say, I have got fresh air. We are still alive. We are in Australia where we're actually quite safe here to a certain extent, as long as we put those strategies into play. Are there questions or thoughts from people?
I had a question.
Yep.
I wanted to ask, whether or not you've got some advice on how to communicate to other people that perhaps you perceive the risk differently to them. So I've been finding that, like, I'm trying to be a bit more cautious, and as things have opened up, people that I know, I'm trying to sort of, you know, gradually expand my boundaries, I think is the word you use, but people are much further ahead than me. So, you know, my family wants to hug, and our church community is going back to church and we're not going, or like our workplace, people are going back. How do you communicate with people when they're sort of so much further down the track than you, that you have a different risk assessment, essentially?
Yeah. And I think there's a real, I think, Emma, thanks for that question, because there's a whole lot, it actually packages a whole lot of what's in our society as well, is if they feel like people are anxious, or they feel like people are being, you know, more cautious, that there's sort of this perception of people actually being weaker. And the whole thing is, we are actually, it goes back to that saying, we're all in different seas and we're in different boats. And the way to actually do is actually to broach it, to say, and broach it quite openly with people if you feel comfortable doing that, saying that when we, as much as we're very much all facing the COVID pandemic, we all face it very differently with different circumstances. And it actually gives people maybe an opportunity to educate people about Addison's disease, that if you were to get it, that you are at high risk. I don't know if people feel comfortable doing that, but I'd actually encourage it. Educates the community. And also just sort of saying to people, you don't feel comfortable. It's about clearly communicating what's going on. And I'd be very much saying, I've got Addison's disease. I feel quite, you know, it's harder for me to actually manage this. I understand. And I'd be setting up some other social cue. I know my kids come up and they all, you know, bash fists instead, which I think scares people away, but they don't think so. And my family have got touching elbows. You can find other ways of actually doing it where you can introduce that to other people. But it's about educating other people and feeling comfortable doing that if you can.
Yeah. I mean, for me, my anxiety is not so much about catching COVID. It's just about having to negotiate all these new social norms, and I'd just much rather stay locked down where I didn't have to talk to people anymore.
And Emma, can I say, I totally understand. And that's actually a huge thing as well, as we renegotiate the social norms as well. There's lots of us who just go, this is so complicated, but every time we go out there now, people are in completely different situations and there's different pressures. So it's not just COVID you're facing. As you go out, you've got people with financial pressures, there's family pressures, people feeling very, very fragile. And so sometimes people, the interpersonal thing can actually be more sensitive at the moment. So you've got that side of things. But at the same token, even if it's hard, I just say we are social animals and we actually do need some of that contact. And if you feel uncomfortable going out, it's a personal decision. But then, and everyone has to respect that, and they should respect that. And then it's about, if you do need that, just trying to have that contact maybe in a safer, and feeling you're quite within your rights to actually say, you know what, all my clients, I just say to them when I see them, I'm happy to do telehealth. I'm happy to see you in person. I'm happy. All of us have to respect other people's boundaries and what they're comfortable with. And I just say that if someone's not comfortable, I'd be gently educating them. So, but I so understand what you're saying. It sometimes just feels overwhelming. And especially actually going back out into society, the nicest thing I've loved about COVID is actually the quietness of it. So actually, I've enjoyed the isolation more, and the going out's actually been, I've found hard. So I've done it very gradually. And I would actually encourage people, if we've all been isolated for so long, is actually only doing it gradually. Otherwise, it's going to become quite overwhelming unless you're a complete social animal. Don't push yourself. Maybe it's one outing in a fortnight and that feels fine, even if everyone else is going out every night. We all have our own tolerance, and you just got to not overdo it and just get yourself there gradually. It's a very personal thing.
Thanks, Laura.
Thanks, Emma. That's great. There's some other suggestions in the chat, actually. Simone has mentioned about being careful with the garbage bins. If you're in an area where the bin people actually touch your bins, I'm not, it's all automatic. But if you're in an area where they do, then obviously they're touching lots of different bins. So be aware when you're bringing your bins in. Another suggestion was having a decontamination area at the front of the house. At your front door. I think that's a terrific idea. And I know a lot of medical people, they have an area where they get rid of all of their clothes, and then they enter the house having removed the potentially contaminated objects. So you can read about Rebecca's suggestion there. Are there any other ideas? I'm aware it's 12 o'clock, gone 12 o'clock now. Are there any other questions or comments that people would like to make at this point?
I have a really happy neighborhood, and we're all friends, like all my neighbors, like for about something like 10 houses. We all get out on the street and chat. But when this happened, I had to kind of go behind my gate, and I put a sign on the gate that you can find them on the internet, and it just says, someone in this house has a weakened immune system. You know, please, if you need to leave a parcel or whatever, you know, and it has just a list of things for the person to be aware of. So then anyone coming to my house is then already aware. So even my postie, who I've known for years, she goes, oh, my mum's in the same situation, and she would just leave the post there and wouldn't have to, you know, communicate. So I think the more you can educate anyone in your life, now all my neighbours are super understanding and don't see it as me ignoring them or, you know, not communicating with anyone on the street. So people come to my big fence and they all talk to me over the fence. You know, so I think that, you know, yes, other people may not understand, but the more that we can just, you know, do little things through signs or decontamination areas, or, you know, educating them, the better we still stay connected with those people, but with a safe distance.
That's great. Thanks, Vanessa. Cathi, and I think Norm as well, and Julia, I think they've got some ideas. So Cathi?
I just found family and friends were very respectful and understanding that I had to sort of, I'm at a higher risk. And so when I was ready to emerge a little bit from the bubble, we actually invited friends to our house. And that was the sign to me that it was, you know, we were emerging from our bubble, and, you know, just over for socially distanced coffee or drinks, or we've got a fire pit out the back. And that's worked really well, because people started to realise then that I was ready to sort of come out, and now we have invitations to, you know, other things and other people's houses.
That's a great
in
suggestion.
The height of it, sort of when everybody was in lockdown, and that, what I did, I baked, and we can't eat it, and that, and so I would sort of make a slice or some scones and that, because Woolies is very good at delivering, and then I would ring up friends and say, are you home? And yep, okay, in 10 minutes, and I'd do a drive around, and in 10 minutes, look on the front veranda and you'll have afternoon tea. And sort of kept in contact that way. And then every Saturday with the grandchildren, I would make cupcakes, and we would drive to their house, which isn't far, put them on their front veranda, ring them up, and they would all come out. And all the kids knew there's 4 children in the family. We would sit in the car and they would stay on their path. And that was sort of, you know, and if we go into lockdown again, I'll continue to do that just for that social interaction, but keeping away. But yeah, we sort of, you know, everybody gave us our distance, and we emerged by inviting people into our house, which I just felt that I was in more control of as well.
Yeah, that's a terrific suggestion, that idea of flagging when you're open for business, so to speak. Yeah, that's great. Norm and Marian, you had an idea?
Oh, no, I was waiting to ask a question for us, which is not COVID. Can I do that now? Or I was asking Victorians, do they have a caring, experienced endocrinologist they can recommend? We've just had a nightmare week. So
we'll keep that question for after. Definitely. We will come back to that. Thanks, Marian. Julia, did you have a comment?
I was just agreeing with Emma. Even at my age, we went out to lunch about 2 weeks ago with 6 people to someone's house. And when we got there, everyone started hugging and kissing. And I'm like, no, go, you know, no, I'm staying away. I don't know where they've been or who they've been with. It's a worry. And it's like, oh, don't bother about that. We're all fine. Well, you don't know, you know.
This is how my mum and
Linda.
So yeah, I just wanted to assure Emma that I know with younger people it would be worse, but probably all of us will suffer that at some stage. Anyway, that was it.
Linda, I've just seen a really important comment on the chat, which comes, I think, from a young person when they've talked about, as a young person, it's really difficult. You don't necessarily want all your friends to know that you've got a chronic health issue or something like that.
Exactly.
Yeah, I want to come to what Julia and Cathi were saying is, it is really hard because maybe you don't want everyone to know and young people aren't going to handle it. But if you can gently educate, it's good, but it's not always the case. It means then in terms of looking after yourself, it's about maybe inviting people to your home, people you're really close with, you're just your trusted friends and stuff, so you actually can look after yourself. And hopefully maybe you can speak to close friends so you can keep that contact up. It's really difficult in the school environment, incredibly difficult. And it's if you feel totally unsafe being there and you don't want to tell people, it's about if you're comfortable letting parents speak to the school and continue with that online education, which is really isolating and difficult because it means you get the hard parts of school, but often not the good parts of school, which is the social bit. So I think in those situations, if you don't feel like you can be open, then you just got to try and have those trusted few people you can have to your house, or you can have around a fire pit at their place or whatever, where you can try and keep that social distancing rules without saying things, but look after yourself and look after your own social needs.
All right.